I think getting them out of the ICU is a good thing because there are certain things that we do to our patients that result in post-intensive care syndrome. So if they are getting out of the ICU earlier, that might be better because that will have reduced exposure to harmful medications, that will have reduced exposure to restraints. That means that their duration of mechanical ventilation will be less. But the important thing is not to get them out, but to get them out with a proper plan of care. To have transitions of care in place where when they go out from the ICU to the floor, the doctor from the ICU would be communicating with the floor physician. And then the next transition, when they go from the floor to a rehab facility or to home, then the hospitalist or the internal medicine doctor or the doctor providing care for the patient on the floor will be communicating with the rehab doctor or the primary care doctor of the patient in a way that they would be embedded in a system so they won't fall through the cracks. Because I think the main problem that happens is the transition of care problems and not getting all the recovery resources organized for the ICU survivor, especially during the time when they get out of the ICU, they go home, they are confused, they don't remember the medicines, they have just gone through a life-changing event. So I think a person or a coach at that time as a care coordinator who can help with these transitions of care and improve communication between healthcare providers will go a long way in taking care of these survivors. I think training will be good, but the question is what would be the format of the training? I think it needs to start from the awareness of the syndrome, and I think we are at the point where we still don't have complete awareness regarding the syndrome. Once there is awareness about the syndrome, then things should put in place to educate themselves how to deal with the syndrome. So I think at this point we need to educate first the ICU doctors, the patients, their caregivers, the floor doctors, the nurses, and the rest of the healthcare community about the syndrome, what this is real, and what can be done afterwards to take care of that. Now, how to train them, that could be a local initiative, that could be an initiative on a national level. The Society of Critical Care Medicine has an initiative associated with ICU survivors. American Thoracic Society has an initiative. American Delirium Society is doing initiatives on long-term outcomes of delirium, majority of the delirium occurring in the intensive care unit. So there are some initiatives going on with education. There are online tools available. So it will catch on, but yeah, I agree with you that there is more training, there needs to be more awareness, there needs to be more work done on the syndrome.